You can go ahead there, Dr. Fitzgerald.
Thanks. Good afternoon, everyone. Sure, you didn't expect to see another briefing so soon. However, felt it was important to provide some clarity around the change in eligibility for PCR testing that was announced yesterday. As I indicated in our last briefing, we intended to make changes to testing eligibility to focus on the detection and prevention of COVID amongst our most vulnerable populations. And there are several reasons why we need to move in this direction. First, it's important to ensure our healthcare system returns to normal order. And regional health authority staff have been redeployed to COVID swabbing and bookings for 2 years now, and it's important to get more of these staff back to their normal duties. And we need to start thinking of PCR testing as a clinical test rather than a population-based testing. For example, when people feel sick with colds and suspected influenzas, we don't swab everyone. Instead, we would test vulnerable residents and those in high-risk settings where the threat of the spread is more important to manage. And similarly, the laboratory processing PCR test is required for other functions that support patient care. So with about 1,500 to 2,000 tests being processed each day around the clock, the lab has limited capacity to do that. So as we move to resuming other services in healthcare, the lab has to refocus, and we have to refine the approach to testing to ensure it is used in the most appropriate way possible. So it's natural that people want to know that the symptoms they're experiencing is due to COVID-19, but it's important to realize that for those that are not in the vulnerable categories, COVID will likely be a mild illness that will pass quickly. If you are a household contact without symptoms and you do not have access to rapid tests, you are still eligible for PCR testing. If you are a non-household contact and you have symptoms, you can get a PCR test if you do not have access to rapid tests. If you have symptoms, regardless of whether you're a household contact or not, you are only eligible for PCR testing if you are at increased risk for severe disease and or eligible for treatment, live or work in congregate settings, or are involved in direct patient care in the health system. So this would include those aged 60 and older, children under the age of 2, First Nations, Inuit, or Métis adults, frontline healthcare workers with direct patient care, those who are pregnant, anyone working in a long-term care, personal care home, community care home, or assisted living facility or correctional facility, anyone living in or working in a shelter, transition house, or temporary foreign worker setting, and anyone immune compromised and potentially eligible for COVID-19 medications. Our province has distributed about 3 million rapid tests into the community through schools, daycare, shelters, congregate living facilities, ambulance services, corrections, and post-secondary institutions, just to name a few. And this week, every student in the province was given an additional 10 rapid tests to take home. Anyone working or attending a K-12 school can contact the school administration to obtain more tests as needed. There is no limit. These can be shared with family, friends, and neighbors, especially if your family has recently been through a COVID-19 infection and you won't need to be tested for another 3 months. It is important to remember that no test is perfect, and tests will only detect COVID over a certain threshold of a viral load. The combination of vaccines and a milder variant means that we are seeing lower viral loads in many individuals, sometimes too low for rapid tests to detect. In some cases, it's too low even for a PCR test to detect. If you do not have access to tests and you are sick, you need to stay home until your symptoms improve and you have no fever for at least 24 hours after your symptoms improve. With that, all that being said, now I'll take questions from the media. Thanks. Over to you, Nancy.
Thank you, Dr. Fitzgerald. We have 4 reporters joining us today. Today's question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Our first questions today are from Ben Cleary with NTV. Ben, please go ahead.
Hi, and thank you. I guess, Dr. Fitzgerald, my first question is, you mentioned giving out rapid tests to students, an additional 10 rapid tests. How many rapid tests does public health or the province currently have right now?
So I'm not sure of the exact number, Ben. I'd have to get that for you, but yeah, we certainly have quite a number, and we certainly have enough to be able to restock supplies if we need to.
And is there a plan to make them kind of easily accessible for kind of the broader public?
So as I've said many times before, when we're using tests, we need to make sure that we're using them in the most effective way possible. And certainly with rapid tests in Omicron, we know that it's not behaving quite the same way that it did with all the other variants that we've had. So right now we are using tests for symptomatic people in the general population, and we've had that in our school programs, but also, if you have access to rapid tests, you certainly can do that. And we are using them in asymptomatic people in very particular situations. So for people who work in, congregate living facilities, and we're using it as a screening test in those situations. So we do have to be careful. So, making it widely available, and what other jurisdictions have found when it's just been sort of open and available to everyone, is that the tests get depleted very quickly and they're not being used necessarily in the most effective way possible. So we want to ensure that that's happening. So we're still evaluating how that can happen and exactly what we need to do. But our goal here is, to move to transition into a period of time when, the advice will be to stay home when you're feeling unwell.
Our next questions are from Peter Jackson with the Telegram. Peter, please go ahead.
Good afternoon. One of the people, researchers involved in modeling in this province, told me this morning that we've essentially now joined those provinces who are best described as flying blind with in terms of the spread of COVID. Do you feel that the data that we're getting now is going to be even worth collecting?
Well, no, I don't think we're flying blind. We certainly are getting information. There are still lots of people who are eligible for COVID testing, for PCR testing. So we do have that. We are watching our hospitalizations quite closely, and people can go online and report their rapid tests. So I think it would be unfair to say that we are flying blind. We certainly have lots of sources of information about the COVID spread in the province. It's not everybody getting tested, but at this point, we can still monitor things quite well without needing to know every single case that's in the province.
Oh, okay. And speaking of information, the new data hub, for some reason, even though the tally is there, is not singling out the number of deaths we're getting per day or per week. Why is that?
So that will be changed as far as I understand. There will be an update today, and new deaths by age will be included there based on feedback from the public.
Thank you.
Our next questions are from Noah Shepherd with VOCM. Noah, please go ahead.
Hi, I guess my question is, how do we know if the COVID situation develops into something where we need to go back into a restriction scenario, or even how the general public can monitor their own risk without getting information from widespread PCR testing?
So I think, we know that there's community spread of COVID right now. So I think all of those things that we've done up to this point is what we have to continue to do to protect ourselves. And we will see, as many other places have, that eventually the hospitalization rates will go down, and we will see less people presenting. Like, as I said, there's still lots of people who can get PCR testing. So those, as the spread of COVID starts to decline in the province, we will see those numbers decline as well. And so we will have an idea as to, when things are ramping up or settling down. So based on the information that we have, we certainly feel that we'll be able to respond.
And just with more limited PCR testing, is there any worry about how the monitoring of variants will be affected?
No, as I said, we're still doing lots of testing with PCR, and we are taking a certain proportion, sample of those PCR tests, and they are being screened and sequenced to look for other variants to do that type of screening. And as well, the federal government is continuing to do screening that looks at that. So the National Microbiology Lab is doing screening as well. And the random traveler testing that's happening is doing screening for variants as well. So that work is continuing and will continue, obviously, as we move through the different phases of this COVID pandemic.
Our next questions are from Mark Quinn with the CBC. Mark, please go ahead.
Yes, thank you. I think people feel like they used to have a tool for assessing what their risk was. People, I think, are expected to figure out what their risk is and sort of behave accordingly. And people who maybe are immunocompromised are sending us notes saying, without the large volume of testing, how do I know, what my risk is in the general population, and whether I should isolate myself or how I should behave accordingly? What do you say to those people who feel like they've lost a tool for figuring out their own risk?
So I think that what we have to accept at this point is that there is widespread community transmission. And so the risk, I don't think, is any different anywhere in the province. And we all need to take those precautions. And people who are immune compromised will have to take those precautions as well. And those precautions are there, during COVID, but they're also there during influenza and any other respiratory viruses that are circulating in any other respiratory season. So, all those things that we have done up to now, staying home when you're sick, wearing your mask, washing your hands, maintaining physical distancing, looking at where you're going to go, what the situation is going to be like there. Are you going to be in a crowded situation? Are there going to be people removing their masks to eat or drink? And all of those things have to factor into your decision making as to what you do every day. So those things will continue to stay, and until we start to see decreases in the testing that we are doing, and decreases in hospitalizations that would indicate that we have less community transmission, then I think people have to be cautious and to assume that that risk is there.
Thank you. As a follow-up, it seems like over the course of the pandemic, we've learned to be very cautious and maybe even afraid of COVID. And now I think people think with the lifting of restrictions and the easing back on testing, that the message is you don't need to be afraid. Has there been a shift?
So I think that, it's a respiratory illness. It can cause significant disease in some people, but for the majority of people, especially people who are fully vaccinated and boosted, this is going to be a mild disease. It's not to say that you should live your life in fear. We obviously have to be cognizant of what's happening around us. We have to be careful. And just because restrictions are lifted doesn't mean that we have to stop being careful. The restrictions are in place. And, the legislation is very clear that we have to use special measures orders when, to the least restrictive means possible. And if the risk can be mitigated through other means, then those other means have to be exhausted. So, we do have the means to do that. We have a good vaccination rate. We have a good booster rate, especially in those populations who are at higher risk. And right now, we are dealing with a milder disease. And so because of all that, that's why restrictions are lifted. It's not because there's no COVID or COVID is not out there or we don't have to worry about COVID. Those are the reasons that the restrictions were lifted. So we still all need to be careful and cautious and assess our risk appropriately.
Thank you.
Thank you, Dr. Fitzgerald, and thank you everyone for joining us today. Please stay safe and enjoy the rest of your day.